Hey there and welcome to Concierge Medicine Radio, your source for actionable advice and real stories of physicians running and growing concierge practices. For more interviews and notes on today's show, please visit conciergemedicineradio.com and enter your email. Now, let's join your host, Taylor Pearson.
Hey guys, welcome back to another episode of Concierge Medicine Radio. I'm excited to be back with you today. We had a good call, me and Dr. Ellie Campbell of Campbell Family Medicine. It's a functional and integrative medicine practice in Cummings, Georgia, just outside of Atlanta. Dr. Campbell has been running her practice since 2005 as a cash-only practice and then transitioned over to a retainer-based practice in 2009. So she has learned a lot of lessons along the way, many of them the hard way, and she shares her experience kind of looking back on what she would have done differently, why you should never charge hourly for your services as a physician, how changing her pricing structure has made her practice more profitable and her patients happier, and how she has used speaking gigs to bring patients into her practice. So you are going to really enjoy today's show, especially for those of you that are interested in functional or integrative medicine. And without any further ado, let's get on with the show. So welcome to the show, Dr. Campbell. We're glad to have you here.
Well, thanks for having me.
So start off, tell us a little bit about your practice today. What does it look like? How many patients do you have? Kind of describe how it sits in the pantheon, if you will, of concierge medicine practices.
All right, sure, I'd be happy to. So I have been solo direct pay practice since 2005. I was one of the relatively earlier adopters. I went to at that time it's called SIMPTE, a SIMPTE conference, and decided after hearing the pros and cons of all different options, I was not ready initially to jump into a full-on concierge membership style practice. So I started just my first day one, opening solo with a cash-only pay-as-you-go model. I had hourly rates, so patients paid me by the hour. And very quickly I learned that my nurse made more money than I did. I worked 70 hours a week. It didn't cut my work hours like I had planned. And the reason was because I was spending so much time on unreimbursed tasks, providing the concierge level service. So calling patients with their lab results, personally calling consulting doctors and discussing their cases, reviewing laboratory data details and looking up journal articles to be associated with the change in the data or something new that I had discovered in my research. So I was doing so many non-reimbursable things that my supposed $300 an hour rate really turned out to be about $100 an hour wasn't enough. So in 2008, I transitioned to a membership style practice where you get paid whether you're working or not. I currently have about 284 patients. I would consider 300 patients a full pool. I'm not quite there, still always taking new patients. There's a bit of a turnover always. It seems like we've been losing a lot of patients of late to transitions. They're moving out of state. So there's been a lot of that of late, I think, with the job market. Interestingly, during the 2008-9 crash, we did not crash our membership like everybody else seemed to. It's now 2013-14 that we're seeing a drop in our membership as patients are relocating for better opportunity.
What do you normally see as an annual turnover? What percent of patients renew?
Oh, renew? Close to about 90% renewal.
Okay. And then 10% you have to replace each year.
Correct.
So are you actively marketing? Do you replace the 10% from referrals? How does that typically go for you?
Yeah, mostly. The answer to your question is I have never found a marketing strategy that's been particularly effective in terms of we've tried radio, we've tried print media, we've tried flyers, we've tried direct mail, we've tried high-end magazines, low-end magazines, free online newspapers, and none of those ever brought return on investment. Where we get the most new patients from is from the internet, from word of mouth, which is number one far and away, word of mouth. And interestingly, from patients, because one of the things that sets my practice apart we haven't discussed is that I do holistic, integrative, and functional medicine. So people will have watched a Dr. Oz episode. Mark Hyman will have been on there. They'll go to Mark Hyman's website. They'll read about what he did, and it'll say, are you interested in a doctor who does what I do? Go to functionalmedicine.org, which is the IFM, the Institute of Functional Medicine. They'll go on that website and find a practitioner link, and that's where I'll be found. So we get a fair number of patients who have read Dr. Hyman's books, Grain Brain from David Perlmutter, or Wheat Belly book, and then they find us through those resources.
Yeah, I'm not familiar with Dr. Hyman, but I've read Grain Brain. That's a fantastic book.
Yeah, David Perlmutter, he's a great guy. I've had dinner with him many times.
Really?
I have, yeah. We lecture at many of the same conferences, so the Speakers Bureau has us on attending the same conferences at the same time, and then the speakers and the invited guests usually hang out together after hours.
I want to come back to the marketing and bringing in new patients, but just so people have a clear idea, what all are the services you offer? What's your price point? Kind of describe your practice to another physician.
Sure. So the way that we started is not the way we finish. I think I've made a few mistakes and learned a few things along the way. All of our patients pay a monthly membership fee to participate, and they have 100% of my time is included in their membership fee. So whether it's a face-to-face appointment, whether it's an email appointment, whether it's a telephone appointment, occasionally we do now Skype appointments, or face-to-face, there's no co-payment, there's no additional fee to come see me. They can see me once a week, or they can see me once a year, and they hold their slot in the membership by paying their monthly fee. We decided to have 3 tiers of membership based on age. Those tiers of membership are age 0 to 25, above age 60, and then 25 to 60 is the middle tier. And the price points are and I did make a decision to write in the contract that there's a cost of living increase every year, so that the numbers don't round up evenly. They're a little on the odd side. For example, our 25-year-olds now pay $109.16 a month. So for round-up purposes, I'll say it's about $100 a month if you're under age 25, about $160 a month if you're up to age 60, and if you're over age 60, it is $209 a month. So that's our price points. One thing that we did, however, was, especially doing integrative and functional medicine, the vast majority of the work that we do with new patients is done on the first visit or 2. So my first new patient consultation appointment is 1.5 to 2 hours in length. And there's a lot of work that goes in even before that 1.5 hours. They fill out a 21-page medical history and diet intake form, quantitative review of systems form, and I review all of that data, and my staff does all the data entry for their past medical history, past surgical history, medication, supplements, diet history, etc. So what we did was we now weighted the membership fees so that the first 6 months membership fees are triple what the rest of your membership fee is, and we prorate that over that for 6 months. So some people call it a joining fee, or they have other words for it. It's escaping me at the moment, where they call, when a patient joins for the first time, they give them a large lump sum at the beginning of $1,000 or $250 or $500. I would strongly recommend that you do that, because you don't get reimbursed for that if you're only charging a monthly fee and the patient decides not to continue to see you after 1 month. You've lost a lot of money in the long run. So I made that mistake early on, where I prorated what I thought was a reasonable annual fee. The patients often felt so much better after 3 months. They're like, well, I don't see the value in coming here anymore. I don't need my blood pressure medicine anymore. I feel great. The reason I came to see you is because nobody could regulate my thyroid. Now it's regulated. All I need is a prescription twice a year. I don't need to pay a membership fee to do that. So I would encourage.
So you actually did have a lot of people came into the practice, went through the intake, and then left after a couple months.
I did early on. It doesn't happen so much now anymore. Now, because we prorate so much at the beginning and people come to see us knowing that it's a very high fee, there's a real value to the perceived practice that when we cut their rates down at the end of 6 months, they feel like they've got a bargain now. So it was a bit of reverse psychology that seemed to work really well, and our retention rate skyrocketed when we tripled the price at the first 6 months.
Interesting. So, yeah, there's like an anchoring bias. They anchor the value of the practice at that initial joining fee, and then it drops.
Correct.
I see. You also do some hormone therapy, I saw
I do.
on your site. So besides what's included in the membership with the Integrative and Functional Medicine, what do you offer?
Well, I think it is all inclusive. So I think that the best, at least in our community, where I'm in suburban Atlanta, so we have a high density of primary care providers. And I think that if you're going to be in a lower density and you're the only primary care doc who's gone concierge, and there's a demographic that is interested in seeking your services. And with the Obamacare, I think that demographic is becoming broader and broader all the time because people are becoming increasingly less satisfied with the primary care that they have access to within their insurance. So people are now seeing the value of that extra $150 a month that they might spend on membership that they didn't see the value of prior. Nevertheless, I think you need to have something that sets you apart, whether you're doing sports physicals or bioidentical hormones or nutrition counseling or prevention. You need to have some value added. And for my practice, it's the entire functional medicine module. So what we do is not only bioidentical hormone replacement therapy and anti-aging. I do IV vitamin therapy. I check everybody's B12, folate, ferritin, vitamin D levels, and we optimize those very often using IV nutrition to get there. The patients feel so much better when you get their vitamin levels optimized. They keep coming back for more IVs, even when medically I'm not sure that they need to be optimized with IV. The patients feel better and they like it and there's no harm in it. So we continue to the IVs and they pay us about $100 every time they come for a nutritional IV. Also works great for hangover for those who might be so inclined on the weekend to be busy. They come for Monday and they can get back to work much better and much more effective when we give them a liter of IV fluid and put a little extra B and C vitamins in there. So we do nutritional therapy. We do a lot of gut repair health. So many people suffer from heartburn, indigestion, irritable bowel syndrome, which really truly have causes. I detect a lot of parasites that have been undiagnosed because nobody ever did a stool test to look for them. I find a lot of yeast overgrowth, small bowel bacterial overgrowth. We put patients on probiotics and help to optimize their gut health. So that's all value added that we do, and there's no additional cost in the membership for those services. However, I do have a very large and ever-growing nutritional supplement closet, and we sell nutritional supplements to our patients. If they're going to be taking vitamins anyhow, I'd rather they got the best quality vitamins and that they pick them up from me, and there's a small revenue stream that we get from selling the vitamins. I don't have an in-house pharmacy. Some doctors have a pharmacist in-house and sell their bioidentical hormones to their patients, having their own in-house pharmacy. I don't do that, but many of my colleagues do.
So all the actual administration is all included in their fee, and then you just charge them at cost for the hormones or the IV or whatever it is they're coming in for?
Sort of, yes. The hormones, like I said, we don't have an in-house pharmacy, so when I draw labs, for example, most of the time we do cash pay price for laboratory. We don't bill labs through their insurance. So I'll check estrogen, progesterone, testosterone, DHEA, and cortisol, and that'll be $150 to do that lab test. I make about $100 in profit when I do that. So there's a little profit from the laboratory. Then I'll send their prescription to the compounding pharmacy, and they'll pay the pharmacist for their hormone replacement. Very often, though, they also need to be buying from me vitamin D, multivitamin, fish oil, coenzyme Q10. So they'll come and get their nutritional supplements from us, and there's a typical 30%, 40% retail upcharge. So I make a little bit of money off the supplements. And then the IV, I don't charge an infusion fee like you would if you were billing through insurance. I don't charge a facility fee, but we do charge for the IV fluids and the ingredients that go in.
And the hormones then, they're not pellets, they're cream, I'm assuming?
Bioidentical hormones can be prescribed in more ways than you have fingers.
Okay.
So I use all of those ways. I do a subcutaneous pellet implantation. As a part of the membership, there's no surgical fee that you're charged for. So if you were to go to a gynecologist and have your pellets implanted, you'd probably have a $200 or $300 surgical fee associated with that. I don't charge that. I only charge for the testosterone pellet themselves, which is custom compounded at a pharmacy and shipped to me for office use. And I also charge for the disposable pellet kit that I use. So it ends up costing about $100 to get a set of pellets, which typically will last the average woman 4 to 6 months. So it's a cost-effective way to do hormones. Progesterone is often given in creams, and I do carry progesterone cream, which is over the counter, and I dispense that from my office. But most of my progesterone is written as a compounded prescription, oral, sublingual, vaginal, or a troche that dissolves between cheek and gum, and they just get filled at their regular pharmacy.
So you very much just kind of figured this out as you've gone along, is what it sounds like.
Yeah, a lot of it.
See what works.
In terms of bioidentical hormones, the answer is it's still very individualized, and that's the beauty of it. It gets customized to each patient. I've probably been to 300 hours of continuing education on hormones in the last 15 years. So it's a passion of mine, and I enjoy it. So I'm always trying to keep up on the latest and greatest of what we know about hormones. What does the Women's Health Initiative teach us? What have we learned since then? How do we optimize the patient's outcomes for symptom control for their menopausal transition, as well as resolving symptoms, PMS or infertility? I've got about 40 babies that were born to my practice from infertile moms who were seen by fertility clinics and couldn't get pregnant, and we were able to overcome that by bioidentical hormones and nutrition. So that's always a fun part of the practice when you get somebody to conceive who was unable to prior. But there's no additional fee for that. You know, they pay $25,000 out of pocket to go see a fertility doctor. They pay me $150 a month.
Yeah, you just
the baby out of the
there.
Right.
In their membership. Yeah,
right.
That's an awesome story, and I'm betting those people hang around for a while.
Yes, they do. And then they bring their children. I saw a 2-year-old today whose mom was a fertility mom. So, yeah, now he's my patient as well.
You're building it out one generation at a time.
Yeah, trying.
Well, I want to take you back to what you said earlier about marketing. You said the two most effective things for you had been the internet and word of mouth. So
correct.
Start with word of mouth. Is there anything you do to encourage that, or is that just totally organic?
It's mostly organic. I would say that the most effective word of mouth thing that we do is probably 4 times a year. I have a seminar. I call it 6 Steps to Wellness, and I do a little hour-long PowerPoint presentation, and I invite my existing patients to bring a friend. And so they sit and they listen to my little presentation about how do you optimize your wellness by eating clean food, drinking clean water, getting your tests and necessary shots. How do you optimize anti-aging with exercise? How do you balance your hormones? So how do you sleep better? So I give this little hour-long presentation about wellness, and then I let the guest, if they have questions, they're invited to ask unlimited questions. But my patients who bring their guests, they do all the marketing for me because they say, well, Dr. Campbell doesn't take insurance. Dr. Campbell only has a membership fee. Dr. Campbell will provide face-to-face. You know, she called me back at 6 o'clock on Saturday morning one time. I talked to her she answered the phone from her bedside. These are the reasons why I pay for this concierge level access and availability from my provider. Whenever I've tried to do that in any sort of print medium, we always get the phone calls. Do you take Aetna insurance? No, we don't.
Right.
You don't? Why don't you take it? Even when the ad clearly says concierge style membership, no insurance accepted, we still ended up fielding 50 phone calls for people asking if we took their insurance. So when we have that organic word of mouth, you don't have to do any of that. The patients are already sold on the personality of the provider. They're already sold on the services offered. They're already served on the delivery method. They're already served on the price point. So it makes it very easy for us. They're ready. They just get going.
And then tell us about the online marketing you're doing. What's been the most effective for you there?
Yeah, the most effective online thing we do is our Facebook page.
Okay.
It is so surprising to me. And the things that get the most hits are the crazy things that, to me, are so irrelevant that they shouldn't even be on there. When I post, a groundbreaking research study about testosterone and heart disease and my commentary about why I think that was a flawed study, I'll get 25 hits. But if I put a picture of the flowers that I sent to my office staff because it was her birthday, we'll get 500 hits and 40 shares.
And do you think that actually helps bring people into the practice? Is it just kind of like a long-term relationship activity?
Perhaps that's what it does. Yes, I think it brings patients into the practice. For example, I had a patient who became a new member about 3 months ago. And when I asked her, how did you find us? How did you hear about us? Which we always do in print and face-to-face when they come for their new appointment, she said, I've been stalking you on Facebook for 1.5 years.
Okay.
But when I saw your Walk with the Doc event and realized that you actually went out to one of the local parks and walked with your patients, I decided you were the kind of doctor that I wanted to have. So I signed up to be a member when I saw that post.
So it was very much you building that relationship with her.
So, yeah, it feels, I didn't know her, but she felt like she had a relationship with me. And when she saw something inherent in my personality, that seemed to make the biggest difference to how she was going to choose me as her provider.
Well, let's rewind a little bit towards when you were just getting started with the practice. What were you doing then to bring in patients?
At the beginning, this is a long time ago, 2005. So I did my little lectures at the local health food store, the local compounding pharmacy, and the hospital. So I tried to get my name out as a community provider in that regard. I had business cards, and I went to all the local providers that had been my referring source because I took insurance. I worked at a community health center. I'd been in the community for 13 years before I decided to go solo. So many people knew me, but they didn't know I now was no longer with that old practice and had a new solo cash-only practice. So I had my business cards and my trifold brochures, and I hoofed it. Every lunch hour, I would go to 2 or 3 different doctors' offices. I'd try to meet the office managers. I'd try to meet the doctor providers, some of which were new in the community, but many who already knew me, just try to let them know I was trying to establish a certain kind of practice and was there to help their patients. Because remember, back in 2005, concierge medicine was still very new. Not many people knew about it. It was a big anomaly, and people thought I was crazy and continue to tell me so those first 4 or 5 years. Now they think I'm a genius, but back then they thought I was crazy.
Easy to say in retrospect.
Yeah, in the respect of, you mean you're not going to take insurance? You're going to take patients' money besides whatever their insurance is? How are you ever going to make a living doing that? You're crazy. And now they get it.
Do you think that was effective? If you could go back and start all over, would you do it the same way in terms of setting up speaking events at health stores, the hospital, going door to door?
I probably would, yeah. Yeah, I don't think the door-to-door was as effective as I hoped. I think the biggest draw is to get people to see your personality. And you do that by being in the community, and speaking events seem to be, even today, 10 years into it, every time I give a speaking event, I get 1 to 2 new patients, sometimes as many as 4 or 5 new patients.
And was that something you approached them about? Did you just contact the grocery store, the hospital, and say, I want to give a speech about
wellness, yeah.
Okay.
And so, for example, when I would go to the Nutrition Depot, I would say, I'm going to give a talk about wellness. I specifically mentioned coenzyme Q10, vitamin D, and multivitamins. Do you have any of those available for sale we can use as props in your lecture? And so I try to at least mention to the audience that, Thomas here at Nutrition Depot offers these supplements for sale, and I strongly recommend them, and these particular brands are good ones. Or when I go to the compounding pharmacy, I try to have him have all these various kinds of a hormone replacement available, I have them look and see, well, this is what a hormone cream will look like. This is what a compounded troche looks like. This is what a vaginal suppository looks like. And these are all ways that you can get your hormones, and depends on what your particular needs are, your particular preference. If you already have a preconceived notion because your sister-in-law used something and you want to try what she tried, these are some of the options. So I try to individualize it a little bit to the venue where I'm speaking to make it worthwhile for them to host me as well. But yes, I would strongly recommend that people get over their fear of stage fright and go out into the community and give lectures. I've given lectures in women's homes. I tell people, as long as you have 10 or more people who make it worth my time to come out, I will give my lecture at no charge to your coffee club, your tennis club, your girls' Mother's Morning Out group, your poker night, whatever it is, and try to make it meet people where they are. So I've given lectures in churches, I've given lectures in women's basements, I've given lectures in tennis clubs and community clubhouses.
I love it. There's a great essay by one of my favorite writers, Paul Graham, who's kind of in like this tech startup world, but he has an essay called Do Things That Don't Scale. And so he talks about all these like well-known, famous, obviously really wealthy tech companies now like Uber and Airbnb and all these guys. And he talks about how they got started out, and it was all like this door-to-door, just pounding pavement kind of thing. And it sounds like you did exactly the same thing.
Yeah, so I don't know that I would go to individual doctors' offices because that's one provider that you meet, right? And you've spent now 20 minutes of your lunch hour to get over to his office and bring a flyer that probably ends up in the trash. But if you give a lecture for 25 people at somebody's office, that same hour, you now reach 25 people. And there might be one person in that audience who has a different club that you'll get invited to at a different time. So it's always been a great way for us to lecture. I've enjoyed lecturing so much that now I do lectures for CME events. So I'm giving 4 different lectures at 5 different CME events in the next 3 months. So that sort of minimizes the time that I'm doing practice building here because I'm creating my PowerPoints and lecturing for the American Academy of Anti-Aging Medicine. I'm lecturing for the American Functional Medicine Association, the Alliance of Natural Health, and one more, Northside Hospital at Canton. I'm giving a lecture about diets. What is the evidence that supports the grain-brain, gluten-free diet, Mediterranean diet, Sugar Busters, Atkins, vegan diet in terms of weight loss and cardiovascular benefits? So doing those sorts of lectures are fun, but they're not specifically for marketing. They're more for CME, for the providers attending. But that also gives me a air in the community that I'm the regional expert, so cardiologists like to refer to me because I can use diet and exercise to help lower patients' cholesterol levels when they're not interested in taking a statin drug. So I do get referrals from other docs in the community because of those lectures.
Okay, so speaking really has been a big part of it for you then.
Absolutely, it has.
Well, looking back now, you've been, I guess, in practice 9 years. If you could, not necessarily if you could go back, but what are some of the aha moments you had? What are some of the lessons you learned the hard way that you'd share to help other people avoid?
Okay, so I think the first thing is my idea of just charging by the hour and not charging a membership fee seemed like a good one at the time. In retrospect, I wish I'd never gone down that path. I think the idea of having a monthly membership fee is a far superior way for a direct care practice. There are some people who do it successfully, but I especially loved the idea because I've become a conference junkie and I go away to lecture at a lot of conferences. When I'm gone for 4 days, I'm still collecting a membership fee, whether I'm in the office or whether I'm not. I don't make as much money when I'm gone as when I'm not here, but I make some. Whereas when I was only doing membership or when I was only doing hourly fee consultations, if I didn't see patients, I didn't make money that day.
And do your patients still have access to you when you're away like that?
Yeah, they do. I have my cell phone, my email, and I have a really good staff who is really great at triage. They're tiny. I have 3 staff. I have a front office reception girl. She's also my IT guru. She does my Twitter and Facebook and web page for me. I have a phlebotomist who's also my medical assistant and starts all of my nutritional IVs for me. And then I have an office manager who does all the administrative stuff, personnel stuff, and inventory for all the supplies and all the bills. And she works with my accountant to keep everything straight. Because when we do the membership the way that we do, if people pay, let's say there's a monthly membership fee, but they want to pay 1 year in advance, what we do is we take 11/12 of their January payment and put it in an escrow checking account. 1/12 stays in the operating account. Then on February 1st, we transfer another 12th. So there's a lot of accounting to keep track of what's in escrow and what's in operating.
And that's a compliance issue, isn't it?
Yes, it is.
Okay.
Yeah.
And did you set that up yourself, or did you have someone that helped you make sure everything was in compliance, double-checked?
I used a consultant to get started switching over to that model.
Okay.
Chris Ewan from 1-to-1 MD was my consultant, and he helped me set it up, and then my local attorney and accountant made sure it was in compliance for our state, because you don't want to be accused of being an insurance company.
Yes.
So that was the biggest lesson learned to me, was to collect membership fees, not consultation fees. Second important lesson was to make sure you write in your contract that there will be an annual increase in the membership fee, so that you don't get stuck charging $100 per month for the rest of your life, because your costs will go up. So you might as well include that right from the get-go with your patients, so that they're expecting an annual increase. That way you get a raise, and if cost of living goes up higher, you don't get raised as much, but if it goes up less, then you get a little bit of a raise every year, and that's good. Another very important lesson that I learned was to weight the practice more heavily during the first 6 months of their membership, especially if you do complex cases, so that you don't lose money from the incredible amount of hours that you spend at the beginning of a case.
Were there any aha moments in your practice when you kind of just the clouds parted and you had some realization, something became clear to you that you hadn't been able to see before?
I think the biggest aha moment was when January 1st came and the Affordable Care Act kicked in, and everybody's insurance rates went crazy, and they didn't have access to the same providers that they had access to, and people were scrambling with complete uncertainty what their health care plan looked like, what was covered, what wasn't. And it's total transparency in my practice. Everybody knows exactly what's covered, exactly what's not. They know the fees for every IV. They know the cost for every lab test. It was total transparency, and that was so comforting to us within the practice and to the patients who are already existing members. I know what my plan looks like. I know what I can get from Dr. Campbell. I know how to get her. I know who she is. There's no new relationship I have to build. There's no worry about the fine print in the plan when I show up somewhere and thought something was covered and isn't. It's total transparency. So that was a big aha moment for us.
Yeah, one thing, Dr. Marcy Zwelling, she's in Los Alamitos, California. She was on a previous episode, on episode 13. She said the ACA was really a tremendous marketing opportunity for concierge medicine, and that seems, everyone I've talked to that's currently practicing, that seemed to be the case, that as it makes things more difficult and more opaque and less transparent, the benefits of price transparency are more and more evident to consumers.
Agreed. Plus, I think in primary care medicine, the relationship that you have with your provider is such an important part of your well-being. And under the Affordable Care Act, Dr. A equals Dr. B equals Dr. C, and they don't see the importance of a relationship in that structure. And so patients see the value. And my personality isn't perfect match with everybody, and that's why there's 15 different concierge practices they can choose from within a 30-mile radius of where I am. There's plenty of business for everybody. I don't ever feel threatened. If a concierge doctor went in immediately next door to me, I think that would be great for me. I think it's just like Home Depot and Lowe's. being in the same parking lot. They don't serve the exact same need of every customer, and we will never serve the exact same need of every patient. But to have a relationship with a doctor who is your family's doctor is worth a lot to people, and they're willing to pay a lot. There's really incredible value in it, and they see the value, and they're willing to spend some of their discretionary dollars to keep that relationship, because when they need us, when they have a scare with a breast biopsy, and they know that we're going to get results and call them that day, or we're going to coordinate care with them and help them negotiate the system. I had a patient who fell and fractured her arm in the parking lot of the post office on Saturday, went to the emergency room, and she called me on Monday and said, I tried to call the orthopedist, and the soonest they can see me is Friday. Well, I got on the phone, and within, 18 hours, I had her another doctor's appointment with the orthopedist because I got on the phone. This is Dr. Campbell. My patient needs to see the orthopedist. She has a compound humerus fracture, and she can't wait till Friday, which is when you gave her appointment. So when you run interference for them, they see the value in that and are willing to maintain the relationship with you because of the value.
Yeah, it's really, they see someone, an advocate in their corner.
Yes.
Are there any tools, anything you use commonly in your practice that someone in a traditional fee-for-service practice wouldn't use that you would recommend in terms of the business aspect and running things that physicians might not be used to?
Yeah, a couple things. I think, first of all, it behooves all of us, if we're in prevention. I did not want to be a vitamin salesman. I went down kicking and screaming to carry nutritional supplements in my office. But I came up with what I thought was a really good compromise. And what I told my patients is, I want you to take the best quality multivitamins that are available. But I don't want you to feel like you're beholden to me to carry them. So I've called Nutrition Depot and I've called Forsyth Pharmacy, and they're carrying these same 3 brands. So I only want you to get brand X, Y, or Z, but you can get it at any of those places. But I have it for sale here for your convenience if you'd like to pick it up here. So that's how I started. There's now a few things I carry that they don't, but I don't feel like patients are beholden to me to get their nutritional supplements, but it's a nice revenue stream. And many of the companies will set patients up on auto ship and just send you a check every month for the 30% profit. So I think that's in a non-traditional practice. When you're touting the benefits of nutritional supplements, and I think we should, there's no reason why you can't make some money from that. So that's one thing. Another thing is I found that patients love the objective data that they get from a concierge practice. And I tell them, for example, not just your cholesterol is too high or too low, but I calculate for them what is their target LDL, or using the new guidelines, I calculate their 10-year Framingham risk and tell them that, based on this percentage, you have a 7% risk of heart attack in the next 10 years, and you should be targeting your LDL cholesterol to this. So that they have goals. I tell them, for example, serum vitamin D levels should be 55 to 80 nanograms per mil. Even though the lab says 32 is normal, I show them a bunch of articles about why it might be more beneficial to have a level closer to 55. So they have actual numbers, and then they're asking me, it's been 6 months, can I check my vitamin D level again? I want to see what it is. And then I make $25 when I order their next vitamin D level. So the patients are happy because they're empowered with information. So I spend a lot of time writing a letter with a template that says, this is what your lab value is, this is what your lab value target is. And that's been a nice tool for patients, and they like that. And it does take a bit of time out of my day, but the patients become incredibly protective of their own data. They carry around their lab reports with them. They bring their little dog-eared letters to their appointments and say, I want my vitamin B12 to be 1,000, and it's only 650. Can I have a B12 shot today? So I think that's a tool that I use. I also use a bioimpedance analysis, so that calculates their percent body fat, their percent muscle mass. People are much more likely to participate in the exercise program that I prescribe exercise as medicine. So they're much more likely to be objective about their participation in exercise when they have the data to go along with it. So anything that you can do in your practice to make health parameters objective helps people. That's why there's such a sale of these Fitbit and other health monitors, because people love the objective data. And if they get that objective data from their doctor, it's even more meaningful.
I'm a total sucker for, I can't speak from a physician perspective, but from a patient perspective or just a consumer perspective, there's tons of things like that where I'll gamify myself, and I know it's just playing little psychological tricks on myself, but it really helps keep me motivated and encouraged. I'll write down, I go to the gym and lift weights, and I'll see I did 5 more pounds this week than last week, and it's just yeah, I'm crushing it. Let's keep going. This is awesome.
Right. Right. So when you objectify those things and give the patients the actual numbers and their targets, they make a game out of it for themselves, and they want their body mass index to be, last time I went in it was 30.1. She said, I'm 10 pounds into obese. I only want to be overweight. How can I lose that weight, so next time I come in, I'm not obese anymore. Those numbers, and they correlate to improved health outcomes. So what we can do to our patients is not only give them guidelines, but actually objective targets. And I think that helps. What other tools do I use that are helpful?
One thing I want to circle back around to, I thought of while you were speaking, the Facebook and the online marketing you're doing, is that something you do in-house? Do you have a process you post twice a day, or how do you manage that?
Yeah, no, it is. We do it in-house. My front office receptionist posts things when things are slow at the front desk. We don't have any particular schedule. We try to have blogs that go on periodically at the beginning of the school year. For example, we talk about ways to reduce your chances of getting cold and flu and the importance of hand washing and taking your extra probiotics during the flu season to keep your immune system strong. So we put those little blog posts out periodically. I have a whole marketing calendar that's posted in the break room, and every month is supposed to be something different that we talk about. February is Heart Month, October is Breast Care Month, etc. I'm ashamed to tell you we don't stick to it. We have it, but we get busy day to day, and we don't follow our own recommended guidelines for posting our blogs and doing our social media and network marketing.
Do you think it would make a difference or a significant improvement if you stuck to it?
It's a good question. The experts would tell us yes, I believe. In September, I'm going to an Experts Academy meeting to talk about those very things, to see what we can't do to get those last 15 or 20 slots filled in so the membership is at full tank. Because that's the other thing, once you've met your bottom line in terms of overhead, once the lights are paid and the staff salaries paid and my base salary is paid, every new patient that I bring into the practice is profit in my pocket. That I either take home as extra salary or I use for capital improvements within the office. I buy new decor, or I take my staff out for lunch or whatever. So it's, from a profit loss perspective, we're at the point where we've been breaking even for a long time, and now I'd really like to bring additional profit into the practice, and I do that by getting more members.
Yeah, I've found I do consulting. That's my background, actually, digital marketing and digital media consulting, building websites and online marketing. And the compound interest on consistency with that stuff I found to be tremendous.
Yeah.
It's, over 3 months, it's not that great, but you look back over 12 or 24 months of doing it consistently every week, and you see really, really great return on investment. Right.
So it is, and the investment in social media is not dollars. The investment is time. So, to sit down to write your blog article takes a few minutes, and then you post it, but it reaches a lot of people and it gets out very quickly, and it is a time investment. Fortunately, in the concierge membership model, you spend a lot less time face-to-face seeing patients, and you have a lot more time to do those sort of things that you can or should be doing, or going home to your family or whatever else. So I love the freedom of a concierge practice. I take a lot more time off than I used to when I was working for other people. I have 3 teenage daughters, and I try to be at every school event, after school, every concert, every football game, my kids in the marching band. So I try to get to all those plays and concerts and not miss anything. And I wasn't as good about that when I worked for somebody else. Now that I work for myself, I get to be the mom a lot more than I did. I work in the office seeing patients 3.5 days a week. Wednesday afternoon I don't see patients. I am in the office. I do administrative things. But Tuesday I work from home. So I do all my phone calls and emails from home. And I have dinner ready every Tuesday night, and I do all my home mom stuff and school things that I can Tuesdays. So it's a much better work-life balance when I have a concierge practice than I ever did when I worked for somebody else.
But it does sound like that came after quite a few years of 70, 80-hour weeks.
It did. And I think I could have shaved that time in half had I started out with a membership model at the beginning. When I started out for 3.5 years just trying to do hourly consultations, it did not pay. It didn't pay well. I had to work way too hard and earned way not enough money.
Well, Dr. Campbell, we appreciate your time. Is there anything you're working on right now that you'd like to let people know about?
Well, I'm lecturing at a couple of conferences. If people are interested in hearing about integrative medicine, functional medicine, and ways that you can transition your successful family practice to a value-added practice with bioidentical hormones or nutritional detox, you can go to some of these websites and look to see if there might be a conference you're interested in attending. So one of them is AFMA, the American Functional Medicine Association.com. We can look at the A4M.com, that's the American Academy of Anti-Aging and Regenerative Medicine. That conference is in Las Vegas in December. IAFNR.com, that's the International Association of Functional Neurology and Rehabilitation. And the last one is AONH.org, Association of Natural Health. So all of those are CME sponsoring events that will provide not only an education in integrative and functional medicine, but also get you some CME hours.
Well, awesome. We will link up to all of those on conciergemedicineradio.com. If anyone wants to go there, they can find all that information. And then what is the best way to get in touch with you if someone wants to follow up and ask more questions?
Sure. You can either call the office, 678-474-4742. Heather's my receptionist, and she can schedule us a telephone time to be sure that we talk. Or if it's a quick question and won't take too long, you can email me at Ellie, ELLIE, .cfm, as in Campbell Family Medicine, at gmail.com. That's ellie.cfm at gmail.com.
All right. Well, we'll put all that information on conciergemedicineradio.com if people want to check it out. And Dr. Campbell, thank you again for your time. It was a pleasure speaking with you.
You're so welcome. My pleasure as well.
Hey guys, this is your host, Taylor Pearson. To give you a little background on the show, after seeing my dad and sister, both physicians, struggle to find a good resource for how to transition from their traditional practices, I launched Concierge Medicine Radio to create a resource to help physicians and healthcare professionals launch, run, and grow patient-centered direct pay or concierge practices. If you enjoy the show and want to help us spread the word to other physicians and healthcare professionals, it really helps us out if you'll leave a review on iTunes. I know the iTunes interface is a little clunky to say the least, so we put together a quick guide on how you can leave us a review at conciergemedicineradio.com/review, or you can go to conciergemedicineradio.com and click spread the word.
Thanks for joining us today at Concierge Medicine Radio. If you found today's show valuable, we'd love it if you spread the word by leaving us a review on iTunes or sharing it with your friends. To see notes on today's show, please visit us at conciergemedicineradio.com. While you're there, leave us your email to hear about all upcoming episodes.